The destructive nature of mouth breathing has been known for a very long time, and evidence of this primal knowledge can be seen in many Native American tribes where mothers would force their infants to nasal breathe by closing their mouth until breathing through the nose became a habit. To expand on this foundational wisdom, consider this. George Catlin, a North and South American explorer and artist, visited over 150 tribes during the 1800s, and during his explorations, he came across the Sioux tribe and witnessed a fascinating event. An altercation broke out between a Sioux brave and a white fur trader. After the dust settled, George approached the Sioux brave and asked if he feared the bigger fur trader. The brave promptly replied, "No, not in the least. I never fear harm from a man who can't shut his mouth, no matter how large or how strong he may be." Along those same lines, several explorers of that time noted that these, quote, primitive societies had robust health and beauty relative to the, quote, civilized societies of the West, leading them to believe that these qualities came from nutrient-rich diets, nasal breathing, and a natural lifestyle. Now, are these just tall tales, or is there evidence for why cultures around the world prioritize nasal breathing over mouth breathing? Let's dive into the evidence and find out. That odd-shaped appendage jetting out from our faces is designed for breathing. It humidifies and modifies the temperature of the air we breathe, which makes it more suitable for our lungs. Plus, nasal breathing improves lung function by increasing nitric oxide. Together, these effects decrease the likelihood of lung infections. Lastly, nasal breathing filters out any bad actors and educates our immune system to possible threats in the environment. Now let's look at the opposite side of the spectrum and address the consequences of a slack-jawed existence. We already covered that mouth breathing is a low-grade form of hyperventilation, which alters our gas ratios. As a result, mouth breathing is strongly linked to sleep issues, impaired learning, ADHD, anxiety, asthma, and head and neck pain. And believe it or not, it can even change the shape of our face. Think of it this way. What happens to a river when the water is diverted? The original path quickly narrows and dries up. Then the surrounding area adapts to the dry environment. This same process occurs when we chronically mouth breathe. Our nasal airways shrink from inactivity, our oral and nasal bacteria shift to a higher population of pathogens from changes in pH, moisture, and temperature, thereby reminding us all of the old adage, use it or lose it. At this point, you might be wondering, how do these changes impact our appearance? The dentist term long face syndrome sums it up nicely. This condition describes all the negative adaptations that go along with mouth breathing. This includes narrow airways, receding chin, poor body posture, dark circles under the eyes, misalignment of the teeth, gum disease, accelerated tooth loss, and weak chewing muscles. You know, the stereotypical mouth-breathing dullard look. But there is good news, because most of these issues can be remedied by changing our behavior. Having said that, the evidence shows that it's ideal to make these changes during childhood. However, there is limited evidence demonstrating reversals in adulthood, but the process tends to be a slow grind. Before wrapping up, let's look at one more factor contributing to that gnarled tooth, slack-jawed look. According to Stanford professor Paul Ehrlich, PhD, there is a strong correlation between the receding jaw epidemic and the industrial/agricultural revolution. Why? Because the foods produced during this time are soft and nutrient poor. The rationale for this concept comes from the fact that teeth and bone develop under pressure. So when this hormetic stress is removed from the equation, the risk of crooked teeth and underdeveloped jaws skyrockets, which gives credence to George Catlin's astute observations that individuals living in tribal societies have teeth as straight as piano keys because they were munching on tough food. Nasal breathing also factors into the equation, but you get the idea. Staying with the pressure theme, evidence shows that placing the tongue on the roof of our mouth will create positive pressure, which can correct teeth misalignments and reshape facial structure. And as you can probably guess, this can occur with mouth breathing. So I suppose we can think of nasal breathing as a natural form of braces, with the added bonus of bringing the jaw forward.